Welcome to the Frontiers Health Voices podcast. I'm your host, Kristen Shanley. Today I'm joined by Valerio Nannini, CEO and founder of Nannini and Partners. Over the course of his career, Valerio has held global leadership roles at Nestle and Novo Nordisk before launching his own advisory firm where he helps startups, investors, and established companies turn breakthrough science into scalable innovation. Lucky for us, Valerio is one of our Frontiers Health curators, bringing one of this year's most anticipated sessions, Longevity as a Control System, exploring how nutrition, biotech, AI, and data are converging to redefine the future of health. Today, we'll explore why longevity is evolving from a wellness trend into a data-driven health paradigm, and how science, technology, and personalized health are reshaping the future of healthcare. So welcome,
Nice
Valerio.
to meet you all. Nice to meet you all.
So
And
you've spent your career. Thank you. And thank you for being a curator with us this year. I know you've been involved in Frontiers Health over the years, but before we jump in, I know you've spent your career leading innovation across global organizations, like I mentioned. But what really sparked your first fascination with innovation at the intersection of nutrition, health, and technology?
well, look, innovation is a very difficult game to play, first of all. So it's not easy as everybody says it. And in most all the corporate, let's say, reports, innovation is probably spelled out probably 50 or 100 times. So is overused and overabused. I strongly believe innovation is where
Yeah.
science and business connect to create new value. And that new value is where really new things happen. And that connection express what can happen in the future. And that's why today, as innovation, longevity is one of the other words mostly used in today's
Yeah.
environment because everybody talks about longevity. A bit about spark by different areas, but longevity become something which is more global. So how you can basically live longer with good quality of life and forgetting about the so-called superficial thing, but going deep into this type of subject matter. And therefore, innovation, which is the connection of business and science, is bringing alive this new value, and that's what we will talk about it in our session. We'll really go deep into that type of paradigm shift that we are seeing around us.
Yeah. Yeah, and I like this idea that you've coined as nutrition being sort of the control system for longevity. Can you kind of explain what you mean by that?
I mean, the reason why nutrition governs the biology that lifestyle and physical performance execute is goes that nutrition basically is not only the fuel of our body, but through what we eat and the type of decomposition, the way we decompose basically the food we eat into macro, micro nutrients are giving us the necessity for fueling all our biological system. And people think about, calories in, calories out, but the thing is much more deeper and much more complex than that. And people tend to take supplements and think with a supplement that's done, but most of the supplements also go through. So it's really eating well and eating well versus what you want to do, which is important because if you only eat well, but you don't do physical exercise, you don't have an active life, also that doesn't mean anything. So the two things really need to be connected very, very strongly because otherwise the thing doesn't work, right? And that's where the complexity is because people think with one thing you do it, right? And with an aesthetic Botox, you become younger again. And that doesn't work. So we move from aesthetics to this concept of
Right.
longevity, which is not made for old people, by the way. It's made for people in their 40s because if you really want to live longer and be better, you cannot start when you are in your 60s, but you need to do it in your early stage. And that's why nutrition plays a very important role.
Right, right. And I know that you're also, AI, of course, is across everything, right? It's changing the world across every industry. But we also have biomarkers, more and more biomarkers, wearables, and now this personalized nutrition becoming part of this longevity conversation. Like, how do you see them, all those things contributing to wellness versus just the typical focus on episodic care, and you only look at your health when you have a problem.
Yeah, that's a great question. And myself and Nestle, in 2014, 15, we were working together with Samsung exactly to try to find a way how we could work together in order we could put on the Nestle side a lot of the nutritional information, which we did, we digitalized. And as you know, Samsung is a big device maker and collects a lot of information about
Yep.
people, not only on their wrist, but also in their homes, in their houses, on the fridges, the way they cook, the way they eat. You can even order meals. So we combine these two big companies together, trying to solve that question and trying to put with an application a way where you can connect what you were eating, who you were, and how you wanted to do it. We were too early at that time. We didn't have AI, and we had a lot of other type of issues to resolve.
Yeah.
So at the end of the day, in 2018, we closed down that project. But being too early doesn't mean that we were not right. In fact, we were absolutely right. So if the people are able to quantify their self, and the quantification of themselves happens through inputs that you receive from either what you do, either what you eat, or how you do it, you start getting a reference point. And that reference point becomes the journey that you need to execute between the ideal you, because that reference point might not be your ideal you. You could think about an avatar, which is your ideal person, to be able to be in that type of long living type of and well-being area. But then you see you have a gap, and that gap is where the interventions of by measuring things, measuring endpoints, can help you to define what are the corrective measures you need to put in place in order you can reach your goal. It seems very easy, but it's not at all easy because it requires a lot of information that needs to be aggregated and put together. AI today is allowing us to do that and will allow us even better, while AI that we would use for this type of tools will be able to really look at reference points, will be able to look at literature, and will be able to quantify yourself versus the ideal yourself. Today, general population measurements is the way we are measured for analytical results, right? Cholesterol, blood flow, and nothing. We know we need to go to what we call more a phenotyping part. Eventually, that will lead us eventually to a personalization path. And all to do that, you need to measure things.
Great. And what do you think the shift means for healthcare, life sciences, consumer health? I mean, they all operate kind of in separate domains, if you will. And like, where do you think the biggest opportunities are, or maybe the biggest misconceptions?
I think collaborations is the word I would use. Collaborating together and not being worried about your own
Yes.
data, your own information. Anyhow, AI is making is basically destroying all that type of it's my information. So I think collaboration is very important. The element related to creativity and critical thinking is very important. So critical thinking means I have
Yep.
something in my hands, but what do I do if I don't combine it with somebody else, right? It remains a nice thing and remains in
Right.
isolation. So I think critical thinking, creativity, collaboration, and communication between companies. And that's why I think Frontiers is going to open up a bit this type of discussion. It's always been forward-looking Frontiers. Frontiers is a place where when I made this presentation around Nestle and Samsung and this so-called, let's call it control system 1.0, and now we're talking about control system 2.0, I had a lot of people ask me about why we were doing it and what we were doing it. But you can then really see how the things are evolving. The AI is basically giving us a chance to put these three C's, as I call them: collaboration, creativity, communication, and collaboration and critical thinking all together.
I love it. Yes. So, and I also know that you have a ton of really amazing speakers lined up for your session. Do you want to tell us about some of them? It's
Yeah,
some of the work that
I
they're
mean,
doing as a little preview.
absolutely, absolutely. And what we try to do, and most probably we have so many that want to participate, we'll have to do two tracks, probably, because 6 or 7 people are too much
Yeah,
for a panel. But probably we'll divide it in two tracks,
one section.
where
Yeah,
one track is going to look at how we're going to measure things in the future. What are we going to do how are we going to measure what we eat that is right for us, wrong for us? And another track will be the type of nutrients that we need to have in our body to be able to um, make sure our metabolic pathways are still functioning even if we age, right? Therefore, we have in some cases a couple of startups who are really looking into the future. How can I measure, for example, through skin that I'm in ketosis? As you know, ketosis is a way to burn the excessive fat. GLP-1 puts you in ketosis. That's why you are basically losing a lot of weight with a lot of other side effects. So we'll have a company which will tell us why they're doing that type of path, and this comes out of UC Davis, and is a very important company. We'll have another company which is measuring intervention nutrition, initially in cancer patients that had really problems in with side effects of cancer therapy. And by nutrition intervention, think about it, you could minimize sore throat or side effects that you would have otherwise with those drugs, right? And work with pharma. And now we apply that type of concept into other type of diseases like obesity and other things. On the other side, we have companies that are working on the future of ingredients that will need to be put in delivery models in a yogurt or in a bar or other things that are helping us to keep on improving and not necessarily through a supplement. So we'll have these two tracks. One, we're looking at the future of measurements and how we can capture that. And another group, particularly a couple of good companies, which are going to come and talk to us what they're doing in that type of space. So I think it's really a step in the future. Some of these things today are not available. Some are going to be available soon. So that's why I think it would be really important to come and listen to us if people have time to to be
Yeah.
with us over the
I
conference.
I'm definitely yeah, I definitely hope I catch it live, but if not, I will definitely catch the recording. Which is good for everyone to know too that we do have a video portal where we'll have all of these recordings because I know there's a lot of sessions happening in parallel. But as long as you buy a ticket, you'll be able to view all that content afterwards as well in the video portal. So you mentioned, I know you've been involved in Frontiers almost from the very beginning, right? Like, were you
Yeah,
there for
yeah.
the
I was
first
I
one
was going with
11 years
Nestle.
ago?
I was coming in 2014 with Nestle. I was invited by
Yeah,
Roberto, who know me before, and been working with few of the partners of Frontiers. So we've really
yeah,
been working together.
that's
And
great.
when I was not directly involved, was coming as a visitor. So I think it's really a glance into the future.
Right, right. So thank you for saying that. So, anything else you want to share about Frontiers, or it really has always been about the conversations that are shaping what's next. What's
Yeah.
one conversation that you hope people will be having a year from now that they're not having today?
I think it's the two things which I would like to leave the audience that are listening to us today. One, the goal is not to live longer, is to live better for longer. My mom is 94 years
Right.
old. She's 94. She's in great physical
Wow.
shape. Unfortunately, her head has left her. So
Wow.
sometimes I'm her brother, and therefore
Mm,
we cannot have a conversation. Is that enough to live 94 years with that type of
yeah.
issue, or is it better to avoid that if you could, right? So that's one thing. And I think the future of health is not treating a
Right.
disease earlier, it's preventing it altogether. And what we've seen, for example, in mental diseases like
Yeah.
Alzheimer, senility, by it's not only food, but by a proper food intake and proper nutrients, you can help the blood flow to circulate better and be able to reach certain points that where it gets blocked today. So I think the is really trying to avoid to get to the point where these things happen, right? But and then the last thing, everybody out there which doesn't understand that looks at things more from a superficial point of view, the consumer question was, how do I get in shape, right? Summer's coming, how to get in shape. Now I think it's getting replaced by something which is more consequential. How do you remain functional, independent, and high performing for the next 30 to 40 years? That's why I said you need to start when you're in 40s, when you start seeing your body. When you drink a bit too much, it goes in the belly. It doesn't go out as it was when you were in your 30s. You start seeing the consequence of your parents when
Right.
you're 40s that are getting older and having some issues. So that's a moment where you need
Yep.
to reset your clock and start understanding these elements So mitochondrial functions, health span, all these things which
Mhm.
today are very medical oriented will become more and more percolated in today's language. And I think people will get educated thanks to AI, thanks to a lot of other things that we could do.
Yeah, I love that. I love what you said about the future of health is not about treating disease, it's about preventing it altogether. And it will be through the combination of personalized medicine, nutrition, and everything you've been talking about, and starting earlier in our lives. Well,
Yeah.
thank you so much, Valerio, for joining us. I look forward to seeing you in Berlin in October, and thank you so much for bringing together such amazing speakers. I look forward to it.
Thanks a lot, Christine, and I hope to see you soon. All of you in Berlin, come along to my session. I really would love to have a lot of debates with you guys if it's possible. Ciao, ciao. Take care.